With the knee exam, we want to do inspection first, looking for the size and strength of the VMO, vastus lateralis, patellar tendon, and if there's any effusions, sometimes you can see some of the markings of the bony anatomy will go away, and you'll see swelling around the knee, as well as redness. If you see redness, it could be a sign of infection, and septic arthritis or infected bursitis or even gout can cause redness. Now, after we do inspection, we would like to have the athlete walk. Can you walk for me? And so inspection should consider both hip and knee should include walking, and we should look at the gait. Look if there's any bow legs, or which is the knees going away from the center of the body, or varus abnormalities, or valgus abnormalities where the knees come closer to the body. Come back up here. Now we're going to go ahead and do some palpation. It's kind of simple with the knee. It includes palpation of the patella, patellar facets, superior and inferior, patellar tendon, tibial tubercle, where the patients who have Achar will have swelling. We'll also palpate the medial collateral ligament and palpate the joint lines. Out here you can palpate, if you can see this picture, I'm going to show you. This is the iliotibial band coming and attaching to Gerdy's tubercle, and you can see it right there. That's the iliotibial band coming across, and it attaches right here to Gerdy's tubercle. And so you can see it there. And then you can see the fibula with the biceps femoris attachment. So we'll palpate all those areas, as well as sometimes with kids, growing kids, palpate the growth plates of the tibia and the growth plates of the femur. And so right here underneath the kneecap where the growth plates of the femur are. In traumatic injuries in kids, this will get injured and you can have Salter Harris fractures. After all that palpation, we'll palpate behind the knee to feel for any Baker's cyst, which is swelling behind the knee. Now, after we've done palpation, we do strength testing. It's pretty easy with the knee. We'll do extension of the leg in the air, hold up, and this is measuring the quadriceps, the patellar tendon. If they have a quadriceps tear or patellar tendon tear, they will not be able to do this. Or fracture of the patellar sleeve fracture, this will hurt and will impede them. Then we'll do flexion strengthening test, and we just see how they flex against resistance, and that should be symmetrical both sides. After strength testing, palpation, we'll do range of motion. For extension, you can look at the legs in extension side to side, and for flexion, you can bend the heel to the butt. Another way to do extension is roll over in your tummy and let your feet fall off the table. And you can see if there's a heel height difference. For every centimeter is 2 degrees of loss of extension. So if this is up by 2 centimeters, it's a 4-degree loss of extension on that side. Roll back over. So now it's time to do some final palpation. Is this going to be the joint line? So to do this, can you come closer? You see the patellar tendon. You see the groove right inside the patellar tendon. You can feel the anterior joint line. Then you scoot over around the medial collateral ligament and feel the posterior joint line. And you can do that for the, scoot around the iliotibial band over here to get to the posterior joint line in the lateral area, right in front of the biceps femoris tendon. If someone has anterior knee pain, oftentimes this is very common, we'll have them resist us when we put pressure on the patella. By doing this test, we call it patellar grind. We'll hold the kneecap and have them drive their knee towards the floor. And if this driving the knee towards the floor causes pain between the patella and the femur, that's a positive finding. Another positive finding with patellar femoral pain syndrome would be grinding the patella underneath the kneecap as you're ranging motion of it. Now, other things can cause pain in this region, including the tibial tubercle. Palpation is probably the best test. For pain immediately, one last thing is feeling for the plica. And he has a plica right here, and it's just a little thickening of the capsule. If that causes pain, that's a sign of medial plical syndrome. Other things that can cause pain on the knee include the inside of the knee, the medial collateral ligament. To check that, we'll flex the knee first, and we'll do valgus motion, where we take this distal part of the leg away from the center of the body. Valgus stretch here, we'll stretch the MCL. If it's hurting, that'll cause pain. If it causes pain or gives way, we'll check in an extension. It's got less stability in flexion, so it should be more positive in flexion. And when you get this extension with all the stability of the femur and the tibia joint, it should move less. To do the same, you can do the same on the LCL, other side of the LCL. Now, an important couple of the tests that we've talked about already include the anterior drawer testing of the shoulder. We have an anterior drawer testing of the knee. To do that, we put the knee in flexion, and then we do a anterior drawer test where we bring the tibia forward. But that's similar to a posterior drawer test where we're doing tibia backwards. If you do bring the tibia forward and it feels positive, you must accomplish this by also doing it in posterior to make sure it's not a PCL tear, which can sneak up on us. Other ways of looking for PCL tears would be to bring both knees in flexion and having the athlete tighten their quads. If they tighten the quads and the tibia moves forward, that's a sign of a PCL tear. That's called quad active test. You can see a sag sometimes too with PCL tears. When they relax, it'll sag backwards. Now, the best ACL test is actually a Lachman's maneuver. To do this, we're actually flexing the knee a little bit, maybe 20 degrees passively. I'm holding them up, holding them, they're just relaxed, and I'm gently bringing the tibia towards me, 10 pounds of force, nothing more, and a quick motion, feeling for an end point and the total motion. A couple of the tests that are described commonly in the knee include McMurray sign. To do that, you feel the knee joint, put your fingers around the joint, and then you circumduct the knee, both in flexion and varus stress, as well as valgus stretch, inflection, extension. Circumduct the knee, put your fingers on the joint line, feeling for a clunk. If you do this test called a bounce home and they have a meniscus tear, oftentimes it's in the back of the knee, it'll cause pain and irritate them.